Often you face problems when composing whole spine. The patient have scoliosis. So this video is for you, and you will get very important tips and tricks for composing whole spine in scoliosis case. You have to keep in mind two things. The two technique is important. One is that you have to keep the positioning block straight in all the steps, cervical, dorsal and lumbar. And the another trick is that you have to increase the slice number so that the slices are covered on whole the spine from right to left. So no portion of the spine should not be cut out. So increase the slice numbers, like I increased here 15 from 11 to 15. So I increased all the protocol slices to 15 so that the slices covers the whole spine in all the area from right to left. So you can see that I am now planning for lumbar spine, and it's the most curved shaped. So I have to do that the positioning block would be in the center, and I have to increase the slice number so that it covers the spine from right to left, and also it makes a parallel line along the other segments like dorsal and cervical. So that's the technique to plan for scoliosis spine. So scoliosis spine is the curved shaped spine that when the spine is not straight and there is some leftward or rightward curved in the spine, maybe in just in the lumbar spine or maybe in the dorsal or lumbar spine. So here I plan the cervical, dorsal and lumbar sagittal protocols, and all the protocols are in 15 in slice number, and all the positioning blocks are straight enough. So these two things are important. So now my planning has finished, and the sagittal to sagittal cervical images have appeared, and now I am planning for the lumbar spine T2 transverse. So you can see that for the scoliosed lumbar spine, the positioning block would be parallel to the intervertebral discs. So you have to angle the slices just along the intervertebral discs in this case. Otherwise you will not get the proper transverse image. Plan the axial slices over the intervertebral discs, and as the discs are not straight, they are angled, so you have to angle the slices. So like this I do here. So if you plan like this, you will get a proper intervertebral disc image and also the nerve root in the both side. And I also get myelogram, and it will show the C shape of the spinal cord and also the curved shaped spine. And SAR limits exceeds, I always increase TR and then click OK. I want to keep it in normal mode. So my whole spine has been composed. So let's see how it appeared. So I have to take this whole spine to 3D to make it a straight one. So I need to see the whole spinal cord in an image. So I have to curve plan this 3D image. For this, in 3D tab I have to select the curve plan and then draw a line along the spinal cord. As the spinal cord is curved, so I have to draw like curved. I have to track the spinal cord so that I can show the mid sagittal spinal cord image and go along with the spinal cord, and changing the image I find the spinal cord and draw the line over it, and slowly I am going up, and just at the base of the skull I finished and double click, and here is the mid sagittal spinal cord appeared, and I am making 3 images of this and saving this. Click start and then close, and yes, and it will be saved. For this, go to Passion browser, and below you can see in the, so this is the T2 team coronal. Now I opened. If the patient have the curved spine or scoliosis, then I take this coronal, T2 team coronal, and provide a film of this, because it shows how the spine is curved and in which angle it's curved. In case of scoliosis, a coronal image must be provided. It's a very important film for the doctors and the radiologist. So I prepared the film in the 5x3 layout, so that the segments are long enough to cover the whole spine, especially lumbar spine. And now I will go for the whole spine and the lumbar spine to print out. So this is the whole spine that I make in 3D, and this is the mid sagittal whole spine. You showed that the spine was carved, but because of my planning and the 3D technique, I able to make this whole spine in mid sagittal plan. So if you follow this technique, you can also make this whole spine from scoliosis spine. Just keep in mind 2 technique. Keep the positioning block straight, not angle with the spine. Keep it straight and increase the slice number, so that the slices cover the whole vertebra from right to left in all the segments like sagittal, dorsal and lumbar. So if you angle the slices or positioning block according to the spine is angle, then you will not be able to make a composed whole spine, or you will not be able to process it in 3D. So that's the technique. Hope you enjoyed this video. So don't forget to subscribe my channel and hit the bell icon, so that you can get the notification as soon as I upload a video. So thank you very much, and also like this video and comment out if you have any question, and stay with me. In future you will get more tips and tricks videos related, MRI related and radiography related. And thank you again. And this is the lumbar spine sagittal film that I make with the whole spine. Thank you.